Dr. Elliott has been studying sexual health and sexual medical health for about the last 23 years.
Thank you very much, and thank you, Marcel, for organizing all of this. So I'm pleased to be here too. I'm going to focus a little more on the sexual health. I've seen a lot of men and their partners in my practice, and it is a significant problem. And when you have a problem with your sexual health, I think the hardest thing is to tell your doctor about it, because the doctor is the wedge into the system that can get you some help. But I'm also going to focus on what having erectile problems means, and also what having low testosterone means to your sexual health. As Dr. Goldenberg said, it is a very important part of your life. It's a way to sexually communicate your intimacy. Some people aren't interested in being sexual, some people are, and both options are okay, but it's not okay for somebody to tell you that you're too old, or that you're too sick, or why are you talking about sex because your time has passed. It's a legitimate medical area that needs to be addressed just like anything else, and so don't ever be shy about asking your doctor. Now, you're not alone if you've got some erectile difficulties. If you look at men between the ages of 40 and 88, just under half of them have some mild, moderate, severe erectile difficulty. That's a large number. And if you see the severe number, the other numbers are roughly, 27, and then you've got 22% that have severe. That means that these men are not able to get an erection in any circumstance, not in the morning, not with their partner, not with self-stimulation. They need some medical attention, and the other people do too. And Dr. Towle is going to talk a little bit more about the psychological and relationship end. I'm going to focus a little bit more on the medical end. Does age matter if you have erectile problems? This is the numbers in if you're under 50, under 60, under 70, and over 70. Roughly, the chance of you having an erectile problem equals the decade that you live in. So yes, age does influence your chance of having erectile problems. But that doesn't mean that just because you're older, you're going to have an erectile problem. And there's many ways to treat it. So what is ED? It's really the inability to attain or maintain an erection for sexual intercourse or for other sexual activities that you find satisfying. So everybody has a little bit of erectile problems here and there. It's the consistent inability to have a problem. So how do you think an erection occurs? Robin Williams said, "God gave man a penis and a brain, but unfortunately only enough blood to run one at a time." So I don't have a pointer, but this is a cross-section of a man's penis. There's three main tubes. The two tubes at the top are the ones that fill up and actually give you a rigid erection, hopefully. The little tube at the bottom is where the urine passes through, but there is erectile tissue in that third tube, and it forms the head or the glands of the penis. What happens when you have a flaccid penis is that blood, this is one of those tubes, blood goes into the middle of that tube, and then it flows outward to the outside of the tube, but it pierces an elastic stocking. So if you see on the one picture, they're sort of white. It's like a stocking that you would wear around your calf. So blood comes in the middle and just goes out through this, what we call an emissary vein. Then you get sexual arousal, some neurotransmitters are released, and the key to getting an erection is that the smooth muscle is something that you can't control by your brain. Those smooth muscles go from being tightly contracted, where all the erectile tissue, the little holes are small, to relaxed. And the holes get bigger and blood pours in. And what happens is that elastic stocking gets very tight. There's a lot more space for blood to go in, but it pinches off the venous outflow. So you can see there's hardly any blood going out. As a matter of fact, there isn't any blood going out. And that's how you get an erection. Blood flow going in. So if you have problems with blood flow, you have bad atherosclerosis or somewhere there's not a lot of blood going in, and you have an inability to trap the blood, then you're going to have erectile problems. And that could be from your nerves not working well too, like in diabetes. This is what we call the sexual response cycle. And Dr. Carter is going to be talking a little bit about how this fits into sexual health and prostate. But basically, it's kind of going up a sexual mountain. So if you have some sexual arousal, what you were aiming for is to try to cross what we call the orgasmic threshold. That's where the nervous systems switch, and hopefully you'll have some sort of orgasmic release. But on that buildup, what we call the arousal buildup in the genital area, that's where erection happens, and the equivalent in women is lubrication, vaginal lubrication, and some elevation of the uterus. So that arousal in men translates into erection. If you can build up that arousal, you'll cross the threshold, and you usually have an orgasm which is accompanied with fluid coming out, which is ejaculation. That's all ejaculation is. It's just a definition of fluid coming out. And then you have a refractory period. It's kind of like a computer overload. You can't get a second erection or have a second orgasm or ejaculation until all those neurotransmitters build up again. When you're young, that refractory period's about 1.4 seconds. And when you're old, it could be even up to a week. So this is normal. Define old. Really old. Okay. So when you do age, you need more stimulus on the penis to actually get an erection. It's almost impossible for somebody in their 90s to have a sexual thought and get an erection. There needs to be physical touch. And that's okay. That's just part of what happens. That's normal aging. The other thing is it's more difficult to reach orgasm. It takes longer and more stimulus. And one of the things that makes it really hard is if your testosterone level is low. Sometimes men can't even reach orgasm, and one of the first things I look for is whether or not they have low testosterone. So that orgasmic threshold does kind of creep up a little bit when you get older. And of course, some men notice that the seminal fluid, the amount of ejaculate they have, goes down, and that can happen again because your testosterone levels are low and the refractory period gets longer. So some men do have this unfortunate time where they try to reach orgasm and they can't, even though they're very close to it. And that is something that we try to help with extra stimulus or looking at things like their thyroid levels or their testosterone levels to see what's going on. And what about male hormone, which is testosterone? What happens to sexual functioning? The first thing that happens, if you were to take a man with prostate cancer, and one of the things they do when it gets to a certain stage is take away the male hormone. And the first thing he's going to find out is that his sexual drive diminishes. So the first thing that goes with lower testosterone is drive or libido. The next thing that happens is that orgasm becomes delayed. And you may have, again, a decrease in ejaculatory fluid. The third thing that happens is that you lose the morning erections. You have REM sleep erections. In other words, you don't have an erection in the morning just because your bladder's full. You have an erection because you're coming out of REM sleep. So nature has provided you with several erections per night during REM sleep. And by the way, women lubricate during that time, but they don't notice it. And as you get older, those REM sleep erections sort of go away. But they're more testosterone dependent than your visual or your daytime erotic erections. So this is the typical pattern that we see as your testosterone levels fall. And when you're older, you don't have the same erectile reserve, so you'll see the erection problems happening sooner. Now remember that all this can be happening in the context of low testosterone, which also means you have less energy, you've got less strength, you can be a little bit moodier or even depressed. And those are signs of lower testosterone. So the sexual changes happen, plus the aging changes, plus your other symptoms. So as Dr. Goldenberg says, we need testosterone for sexual function, for energy, to maintain the bone mass, for proper cardiovascular function. If you've had one heart attack and you are hypogonadal, you have twice the chance of having a second heart attack compared to somebody else whose testosterone levels are normal. So it's not something to just leave. And it affects mood. Do you remember that movie with Walter Matthau? I bet you they were both hypogonadal. Why ask about sex? Because these dysfunctions are very, very common. You are not alone, and they're very distressing. Some men lose erections or lose desire, and that's okay with their partner, and they don't care either, and that is fine. But if you're distressed about it, then you should see somebody, a physician, a healthcare professional. But the other thing I want to tell you, it can signal other illnesses, and it may influence other illnesses. If you have erectile dysfunction, it can make your depression worse.